My name is Faduma, and I'm delighted to welcome you all to today's webinar, Digital Health, E-Labeling, and Health Literacy, focusing on lessons on self-care from the Global South. This is a virtual webinar co-hosted by the African Diaspora Network and Opella, formerly Sanofi. And building on Opella's pioneering work in e-labeling with the International Pharmaceutical Federation and ADN's network of healthcare experts, this virtual forum today brings together global voices to address the critical need for improving access to health information and services, particularly through digital health and e-labeling. And as we know, in many African and Asian countries where formal healthcare is often limited, self-care is sometimes the only form of care. And this makes health literacy so important, especially when pharmacists are more accessible than doctors. And so today we'll be exploring how e-labeling and digital health advancements are revolutionizing healthcare with a look ahead to Opella's upcoming health literacy project in Bangkok. We'll also highlight how global best practices, particularly from a South to South perspective, are centering patients in healthcare. So to kick off this important conversation, I'd like to give a warm welcome to the virtual stage, Dr. Josephine Fubara. Josephine is the Chief Science Officer at Opella, where she and her team are responsible for overseeing the innovation of over $5 billion Euro business. She is a research and development leader in the pharmaceutical industry with over 22 years of experience. And prior to Opella, Josephine was the global R&D head of all over-the-counter categories at Bayer and spent over 18 years in Pfizer as well, leading innovation and development in categories like pain, respiratory and digestive health, among others. And in addition to all of that, I'm proud to say that Josephine is an esteemed board member at the African Diaspora Network. But yeah, warm welcome to you, Josephine, and over to you to kick us off.
So thank you, Faduma. You stole a little bit of my context setting, but I am super excited to be here. It gives me great pleasure to really be able to engage and set the context, for this wonderful webinar that we're going to have. ADN and Opella, we've been in partnership for quite a while now, really driving self-care. So really looking forward to talking about self-care, a topic that's near and dear my heart. And I'm quite passionate about it, because I am originally from Africa, from Nigeria. And as Faduma said, in parts of Africa and Asia, where access to health care is limited, self-care may be the only health care that people ever get to see and or have access to. And delivering quality health care in these continents, African and Asian contexts, can be quite challenging. From a shortage of healthcare workers to insufficient local language, health information, and lack of digital health solutions as well. So that's why I'm super excited about this webinar, because the esteemed panel that you're going to hear from today will share best practices in health literacy and digital health from the Global South. So it's going to be a South to South sharing to enable self-care implementation. And like I said, I'm also very excited and proud about the partnership between Opella and ADN. We're united in our commitment to self-care and to ensure that, people, take health in their hands, to empower them, to do just that. And everybody right on the call, on the Zoom, has a role to play to advocate for better self-care. I do, ADN does, you do, Opella does. In these regions, and a webinar like this actually provides us with the right platform to have this discussion. So very briefly, what I'm going to do in setting the context, I will talk about the significance of self-care. I will talk about some of the initiatives like e-labeling that drive self-care and discuss specifically what we're doing in Opella. And lastly, I'll do a quick call to action, for everyone. So starting, with the significance of self-care. Self-care goes beyond empowering people to take health into their hands. It also reduces the burden on our already strained healthcare systems. And believe it or not, it also has a positive impact on the environment, because the more people that can take care of their own health, minor ailments and clinical common conditions, the fewer people will go to doctors' offices, And in turn, it reduces our carbon footprint. And this is what I personally call the triple value of self-care. And another reason why self-care is quite significant is something that Faduma and I just touched on, and something that's really near and dear my heart because of where I come from, Nigeria. Um, Many places across Africa and Asia, self-care is the only form of healthcare that many millions of people will ever see. So it's a shared responsibility, and we need to make self-care accessible, to all. So health literacy and digital health, the topics that we're going to be talking about today, are key components of self-care practices that empower people to take health in their hands, and the health of their families as well. And we're all here today because we understand the need to support patients and consumers in the global south to access information and services that contribute to their own health and the health of their families. So what are some of the examples of enablers of health literacy and digital health? I touched a little bit on e-labeling. In many countries across Africa and Asia, there are hundreds of local dialects. So in Nigeria, where I come from, there are over 300, dialects, believe it or not. And this makes it challenging, right, to have all of that, all the product information, right, on medication labels. But impactful initiatives such as e-labeling have provided product information in digital formats instead of having paper inserts to ensure easier access to more accurate information. In Australia, for example, the Therapeutic Goods Administration, the TGA, has implemented a system where paper leaflets are not required anymore if all the mandatory information are able to be contained on the product package. And what this initiative ensures is the fact that consumers and patients have access to the latest and most accurate information through QR codes and website links. And in addition to the sustainability impact, this initiative has the additional benefit of making sure that the information is more accessible to the consumer and the patient in their own language. So let's bring it a little bit closer home and maybe do a quick deep dive, very quick deep dive into some of the Opella initiatives in Asia and Africa to enable self-care. Like I said, we all have a role to play. We lead several initiatives in the continents of Asia and Africa, working with policymakers, associations, non-profit organizations, HCPs, doctors, and pharmacists to bring health in the hands of consumers and to bring our mission, which is Opella's mission, health in your hands, to life. Now, I found this statistic I'm about to share with you to be a little bit stunning and in a way sad. Diarrhea remains a leading cause of child mortality worldwide, right? I mean, just pause and think about that for a second. I mean, diarrhea is something that should be easily managed and should be easily, controlled. And what we've learned in Opella is that by improving healthcare literacy and self-care practices, we can greatly improve health outcomes. So in Vietnam, for example, our probiotic brand called Enterogermina, I'll do a little test later on to see how many of you remember how to pronounce the name Enterogermina, has partnered with the Hope Foundation to prevent childhood deaths from diarrhea. And what this partnership included was installing toilets, facilitating educational activities to raise awareness about personal hygiene, and providing filter tanks for domestic water supply. The result is stunning. Over 9,000 students and teachers in Vietnam benefited from the project, and about 44% of students reported stronger immunity. The second example I want to share with you is from Egypt, where for complementary medicines and even for hospital products, we have been able to remove our product information leaflets and replace them with QR codes and access to, website links so that consumers and patients can easily access the information. One that's a little bit closer home to me in Northwestern Africa, Morocco, Algeria, and Tunisia, we've implemented smart packs. I call them talking packages, where shoppers can scan the QR codes on their products, and the smart pack platform will read aloud the information on the product and allow the shopper to find out more about the product at their own leisure or pleasure. And I'll just take one more example because I have a few more, but in the interest of time, since we only have, 1 hour. The example I want to share is the work that we do with HCPs, pharmacists, and community health workers, because they are critical advocates for better self-care literacy across Asia and Africa. We have been able to reach over 60,000 healthcare professionals in person and digitally through our partnerships with health education program platforms across the Philippines, Vietnam, South Korea, and Indonesia. One example of how we're doing this was in 2023, we launched the Pharma Academy in partnership with Swipe RX. And it's a program that's designed to provide education and self-care tools for key opinion leaders, healthcare professionals. And we launched this program at the Philippines Pharmacists Association Convention, allowing us to reach a number of HCPs. Now, what I want to end this with is a call to action, right? One of the things I said was that I think it's going to take every one of us, playing our role in order to drive self-care and to enable it, through some of the topics that we're going to be talking about today. So the path forward requires a unified effort from all stakeholders to ensure that we can harmonize our digital health platforms and policies that facilitate self-care. Two, to be able to invest in credible health literacy and education programs, as well as three, advocate for holistic health strategies. And this includes advocating for healthcare policies that include self-care, especially in the light of the upcoming OTC resolution discussion at the WHO that will be happening next year. So if you are in the audience and you're a pharmacist and you're a regulator and you belong to an organization that advocates for healthcare policies and you are in the government, my ask is that you support this WHO resolution. It is key to the adoption and implementation of self-care globally. And in doing so, and with everything else that I'm sure that you'll be doing to help us advance the topic of self-care, we can really forge a future where self-care and healthcare literacy are integral parts of everyday life, ensuring healthier communities right in this continent. So before I drop off, I want to say a big thanks to ADN, for the continued partnership as well. I'm really looking forward to hearing the esteemed panel moderated by the fabulous Inde. Looking forward to hearing what you guys have to share, with us. And thank you for your commitment to advocating self-care, and look forward to more collaborations. So I hand it over now to Faduma.
Wonderful. Thank you so much, Josephine, for that powerful foundation for our conversation today. And it's my pleasure to introduce you all to Ndeye, who's going to be moderating our panel discussion today. Ndeye is also an esteemed board member of the African Diaspora Network, but is a bold and visionary pharmacist as well, with over 20 years of experience in the biopharma industry. She leads global transformation, where her expertise spans across program management, global supply chain, quality control, in both developed and emerging markets. So passing the virtual mic over to you, Ndeye, to lead us through our panel discussion today.
Thank you so much, Faduma. I'm super excited to be here, and welcome everyone to our webinar on digital health, e-labeling, and health literacy, the lessons from on self-care from the Global South. This topic is really crucial in our rapidly evolving healthcare landscape, where the technology and accessibility intersect to reshape how we approach self-care and patient education. So in many parts of the Global South, there are some innovative approaches to digital health, and e-labeling are emerging as powerful tools to overcome traditional barriers to health access and education, just like Josephine has said so. Before we get started, let me introduce our esteemed panel. We have a couple of experts today on our panel. Let me start with Nishan Govender. Nishan is a seasoned clinical pharmacist with a pharmacy degree from Wits University, a Master of Pharmacy degree, and a postgraduate diploma in clinical pharmacology from UKZN in South Africa, I believe. And he has over 25 years of experience in the pharmaceutical and healthcare sector, holding position in clinical practices with community and institutional pharmacy, both in the private and public healthcare. He also has experience in clinical research and academia. So he's currently the head of medical and scientific affairs for Helion, South and Sub-Saharan Africa, and still maintain an active role in pharmacy, clinical pharmacy, as well as pharmacist education in the rational use of medicine, as well as patient safety. So welcome, Nishan. We're really very happy to have you.
We're having a hard time. You're breaking in and out. We're having a hard time hearing you.
Can you hear me?
That's a little bit better. Maybe
okay.
Let's see what happens. Yep.
Yeah, sorry about that. All right, so then our second panelist is Nasser Jallo, and Nasser is a founder and CEO of Clinic O, a social enterprise that builds technology-enabled solutions to eliminate barriers to accessing quality healthcare for the marginalized community in West Africa. Before starting Clinic O, Nasser worked as a public policy analyst at Facebook, where he helped design programs that support digital literacy, prevent internet shutdown, and stimulate the growth of digital economy in sub-Saharan Africa. Nasser holds a BA from the Georgetown University and a master's degree from Oxford University in the UK, and then in Sciences Po in France. Welcome, Nasser. All right, so let's begin our discussion by exploring some of the key questions with our distinguished panelists. I'm going to start with you, Nishan. Can you discuss South Africa's approach to self-care and also sharing methods for digital solutions used to improve health literacy?
Yeah, thank you for inviting me, and good evening, good morning, everybody. I think, when we looked at it, it's looking at part of the definition of what self-care is, and it's something that I took out of FIP, the FIP definition. And it really, the one part that strikes me is that it's an individual's ability to cope with illness, with or without an HCP. And you mentioned it, Josephine's mentioned it, there's serious disparities in health literacy and health inclusivity in lots of the African countries, including South Africa, right? And lots of this has to do with how we access medicine information. We have these products, and it was said before that for the most part, and I've had personal experience with that, for the most part, in rural areas, in lots of the outlying areas of South Africa, self-care is the long and short of healthcare. So whether it's a paracetamol or something similar, that's the entire breadth of healthcare that these patients have. They have access to that medicines, but they don't have access to the information on its correct use. And that's where we find that problem. I think, all of this started with discussions with our regulators, so the South African Health Products Regulatory Authority and the South African Self-Care Association. And it was looking at a singular point or tool to house all of this health education, or package inserts, e-labelings, and the like. And that's where it started. I mean, we collaborated. This tool was created by SAPRA and ourselves. Now houses most of our over-the-counter, so all our self-care meds, whether it's the package insert or the patient information leaflet. But I think that collaboration with our regulator, they had the forethought to use this as the prelude to e-labeling and to the introduction of this e-labeling in South Africa. I think it was around the beginning of this year that the Self-Care Association drafted a white paper that laid out a proposal to implement a pilot project for e-labeling in South Africa, and it dealt with the medicines that we mostly use, which is all self-care products. So that's where we're sitting right now in terms of that. I think the primary take out of that is that this collaboration with not only our regulator but our HCPs, the pharmacists, the doctors, and the like, was the way we developed this entire thing. And if you look at lots of the research and lots of the other countries, there's always been barriers about who hosts this information and who controls it, and privacy issues, so forth and so on. And we were fortunate in the fact that our regulator was progressive enough to say, well, we're going to do it first. So we've created this mechanism to house all of this information. And now it's about taking that step further, making it more accessible to the general public, opening up that by pulling out the package insert, putting on QR codes, and Josephine mentioned various examples from all around the world, and we're going to emulate that.
That's wonderful, Nishan. I'm really very happy to hear about. It sounds like you guys are working very closely with the regulator, but also it's more like multi-stakeholder approach, housing the information so that the information is available to and more accessible to people. That's wonderful. Thank you for sharing that. Let me get to Nasser. Can you please help us explain how Clinic O leverages digital health platform to address the healthcare gaps?
Thank you so much, Nay, and thank you so much to the ADN and to Dr. Josephine for being here. So in terms of context, so Guinea has 14 million people. That's where we are operating right now. And 50% of the Guinean population, meaning 8 million people, have no access to primary care services. That's just the reality right now. And this is due to the lack of infrastructure, meaning we don't have enough doctors, we don't have enough community health centers, we don't have enough hospitals, right? And all those 50% of people that I'm referring to, they live in rural locations. I grew up in rural location, watched my dad, who was having diabetes or who had diabetes, travel over 300 kilometers one way, 600 kilometers round trip to check his blood glucose. I was little at that time. I knew something was not right. Until today, we have that situation. That's the context in which we are operating. We do not have enough electricity. We do not have enough internet connection. So what do we need to do? One, we understood that to achieve universal health coverage, it's very, very helpful for us to put everyone on one platform. You have to identify the people that you need to offer services in rural locations before starting offering them some services. So we built an offline platform that give us an opportunity to connect with these people. Second, we connected with the largest mobile network operator, which is called Orange, to give us an opportunity to have hotspot where we can have connectivity, because offline works only if you are able to be online to collect the data that is offline, right? So with that, we link or we free ride on the existing infrastructure. There are community health centers in rural Guinea. They are not perfect, but they are there. So we partner with the government to get into these community health centers, pre-ride on their existing services to offer what is not available to the patient who need to travel to the next level of care. So far, we have been doing that for about 50,000 patients, helping them save an average of $22 in transportation cost and over 300 kilometers in travel time. That's how we have been operating so far, collecting data, working with the existing infrastructure, and linking patients to the next level of care through the support of community health workers that we are working with in rural locations.
I mean, it's wonderful to see, though, like the theme that is coming up right now is really like the partnership with different stakeholders in the country to enable this to happen. Like in your case, working with the communication companies as well. I'm curious, Nasser, are there, since you guys have started, are there any specific example of improving access to care in Guinea and Senegal? And also even like what has been the impact so far for the underserved population and any lessons learned that you may have?
So there have been some cases in which we have improved care, because what we found is 67% of the people that we have worked with, or those 50,000, do not need to travel to access care. They can access care within the comfort of their village without traveling, right? So that's the first thing that we found. The second thing that we found is digital literacy is a survival skill, not only for healthcare or for self-care. It's a survival skill for extremely poor people. If people are digitally literate, they can access not only healthcare, but they can also use mobile money to sell their crop. And three, I think Dr. Josephine mentioned that diarrhea is the leading cause of death worldwide. So we are tackling diarrhea right now by connecting all the community health workers who do not have supply through the data that we are collecting, right, to the Ministry of Health. And all of that is going straight to a platform called DHIS2. That is the main platform the Guinea Ministry of Health is using. Keep in mind, before, the Guinea Ministry of Health was collecting data on paper. So they have these big registries where they collect data once in a month. They send that registry physically to Conakry, the capital city, to enter that information, right? So right now we are collecting that data in real time. So the demographic data, the vital data, and the medical data is all at the hand of policymakers in Conakry, which help them make decisions, but at the same time help bring in other partners to help those people who do not have access to clean drinking water, to proper sanitation, because healthcare is also linked to the determinant of health. So that's how together we are working with not only the Ministry of Health, but all the other partners while staying focused on healthcare.
That's amazing. Thank you so much, Nasser. And getting back to you, Nishan, can you highlight any challenges or successes in promoting self-care, especially in the rural communities?
I'm glad Nasser just said, the digital literacy is a survival skill, right? And
yes.
And that is actually so true. Right? I think when we look at what the biggest challenge, especially in South Africa, one would think that is it access to the internet. Right now, if we look at the stats, I think 75% of our population have access to the internet. And the current projection is that by 2029, we're going to have 98% penetration. And right now, I think the number is somewhere around 99% of those internet users have a smartphone. Right? So I think we sometimes think that digital literacy is going to be a barrier, but the data is telling us a little bit different as such. Our biggest challenge is, and Josephine also said it, we have a country that has many different languages. One of the ways that we believe that self-care needs to be put forth is in an accessible way, but in a way that it is understandable to the end user. So as a clinician, I always talk about point of care. Right? We want that information at the patient's demand or the HCP's point of care. And e-labeling is the tool for that. What we've currently done, especially in the platform that was developed together with SAPRA, is that it would allow for multi-format, multimedia. So it does not necessarily have to be a text PI. It could be a voiceover. It could be a video. I mean, I've attended a few congresses with AI about AI in health. I mean, the technology is advancing so fast that I'd be very interested to see how AI is going to help us move that self-care and health literacy agenda forward.
I'm certainly also very curious about that. And I feel like AI can really accelerate all of this and increase digital literacy for people in these marginalized communities, mainly in Africa. I have certainly seen in my experience people traveling kilometers to get to care and having these digital tools. I agree with you and Nasser that is a survival skill. So thank you for sharing your thought. So now let's engage our audience in a quick poll. So if Faduma and others can help me with that. And then which aspect of digital health do you believe has the most potential to improve self-care globally? Is it telemedicine, health tracking app, e-labeling of medication, or online health education resources? So please go ahead and then take a moment to cast your vote, and we will discuss the result shortly. Going back to you, Nasser, can you please tell me, what are the key obstacles, right, for implementing digital health solution in your respective countries? Like both Senegal, I know you're recently studying in Senegal, but what do you see as the key obstacles and how you have been able to address them?
So one of the key obstacles are, I would say, the policy. Healthcare is heavily regulated, but regulated um, traditionally, not the regulator is lagging behind digitally. They don't know what to regulate, right? So in terms of data, for example, data protection, confidentiality, and so on, it's kind of, they are using either the GDPR or the HIPAA copy paste, right? Without figuring out what are the implications of that. So how can we bring in the regulator around the table to do co-regulations to help us put a framework that is tailored to the realities of our communities? A good example for that is um, we have doctors in Senegal, we have doctors in Guinea. The doctors in Senegal are accredited by the National Order of Physicians in Senegal, right?
Mm-hmm.
They have their certificate. But a prescription of a doctor in Senegal will not work in a pharmacy in Guinea. And we are all in West Africa, right? That's a big challenge because we have one physician per 10,000 people in West Africa, right? Why can't we use the existing resources? A good analogy is, why can I do a WhatsApp call to you today, all right, bypassing all the regulations wherever you are, and I need the permission of someone to confirm a prescription whereby the country of that person says they are allowed to prescribe. So I think at the regional level, we need to work on those regulations. The second thing is connectivity. I think connectivity is an issue. Telehealth can revolutionize healthcare in rural locations, right? If we combine it with the context of understanding that our communities do not accept telehealth from the Western perspective, a patient and a telephone in rural Guinea or rural Senegal would be difficult, but a community health worker with a patient and a telephone can work because the community health worker can help steer out the patient, and that would work well. So working with mobile network operators and regulators to help us expand connectivity in rural locations will be extremely helpful. For now, those are the top two challenges. How are we addressing them? We are working with Amazon Web Services. We are working with YouTube. We are working with Google and bringing in government to do what we call co-regulations. So we bring in the regulator with these organizations, telling them, listen, this is how these things have been done in other countries, and potentially this is how we can do it in this country. Do you agree? So they can see the complexities of what it means to regulate some of those things. One. Two, in terms of connectivity, it's showing the mobile network operator the data of the people who might be able to engage with smartphones, because most of our communities have feature phones, right? And if they engage with smartphone, they would be buying more data because data is pay as you go. So it's more revenue for them, right? So, and seeing how the government can put forward policies that can support that. That's how we are approaching it in Guinea. And if I can slide quickly, in Guinea, we have what we call dedicated pass, whereby we ask mobile network operator to give a discount to anyone who want to use connectivity to do telehealth. If like the cost of a pass is $1, if you want to do it for healthcare, you pay only 50 cents, but it's only for connectivity. So those are some of the things that we are doing in Guinea, and so far it's working.
Oh, wow. That's a lot of, like interaction with different sector in the countries. And I'm so glad to hear that, people having a lot of, it's like everybody's in Africa has like one or two to three phones. And if we can expand that to the rural area, that's even better. So excited to hear all of that. The next question is for you, Nichelle. Can you, given that, like I think that South Africa, you have adopted the e-labeling, like you said earlier. How do you see these methods addressing the unique challenges in the rural and underserved communities that you have mentioned earlier? How is it addressing those challenges?
Yeah, so we've partly adopted e-labeling, and that's together with the regulator, right? So currently, South Africa has an online directory that has the information of all the over-the-counter medicines that are available to you in South Africa. It's going to be expanded to prescription medicines on the next phase. Right? However, our regulations still stipulate that there needs to be a package insert in the product, which is what we're working on together with the regulator now. We don't know what we don't know. Let me put it that way. So what we're going to be doing is actually running a pilot project, and we've commissioned some academic research to see what the needs of our patients, or our consumers, or the consumers of self-care, and HCPs like pharmacists and the like, what their it's a knowledge, attitudes, perception, a type of study, so that we can evolve or adjust the way we put these things forth. There's lots of benefits of something like this, right? Whether it's increasing inclusivity by having it in your language, to Nasser was talking about the fact that you get a discount if you use that. So we have a very similar thing in South Africa, where our regulator is looking at what they call zero ratings. I'm not a tech guy, but it's zero rating the site. So anybody using a smartphone that goes on to the online directory, there is no data charge. So it's absolutely free. So you don't need data. You just need access to a Wi-Fi or a portal to be able to get it. But there's no data charge or connection charges for that.
Wonderful. Thank you so much, Nisha. This next question is for both of you. You both have mentioned policies and working with government. From your perspective, what policies or infrastructural changes are needed for governments to support the wider adoption of the digital health tools like e-labeling and any other mobile health platform? Maybe Nasser, you can get us started on that question.
Thank you so much, Ney. And this is crucial in order for us to move healthcare. What we understood as a social enterprise is, it's one thing to be a clinic, it's another thing to think about working with thousands of people who are in rural locations. The government have to chime in. So I'm going to split it into two, a carrot and a stick. The carrot is, it can be done through us, meaning the public-private sector partnership, like in the government and the private sector could show the benefit of using telehealth. The way we are doing it, it's by, or the benefit of using digital technologies, right? So the way we are doing it, it's by showing the community what they can achieve with digital health and what they can save. These people are poor, but they are very intelligent. They do the cost-benefit analysis and they make their decisions accordingly. What is the stick? The stick is, our government, at least in Guinea, do not support universal health coverage in reality. And what that means, it's not just saying universal health coverage. How much money are you putting in to encourage people to be part of that platform? So let's say if we have 50,000 people who are suffering from diabetes, are you subsidizing the cost of medication for them? There is an opportunity for you to put these people on using your stick by saying, you know what? You have to go do your checking, you have to do this, you have to do that. So these people can stay on the platform, because the challenge is in Guinea, in many West African countries, people come to care when they need care, meaning when it's too late. So that makes the cost of care extremely high. We are struggling to maintain these people within the realm of preventative care. The people we are serving make less than $2 a day. It makes no sense for them to get sick. So we need the government to make policies that are towards saying, if you stay healthy, we can support or we can subsidize a portion of your care, the way it is done in the US here with Medicaid and Medicare. Those are the two things that I have in mind right now.
Thank you so much. It's basically incentivizing, policy incentivizing population to take care of themselves rather than waiting until they get sick, which is bringing more pressure to the health system. Absolutely. Thank you for sharing that, Nasser. What about you, Nisha?
Yeah, I think, any Department of Health or regulator that's not looking to the future in terms of digital, and whether it's telehealth, whether it's e-labeling, is shooting themselves in the foot, right? Because these things are changing so quickly.
Yes.
I think for us, it was one of the successes that we could speak about, because it's something that we collaborated with the regulator, or they collaborated with us. So I mean, Nasser said it as well. Those public-private partnerships are so important, because sometimes a Department of Health or a governmental institution might want to do something, but it's just for somebody to come up there and say, guys, here's what we can do. Can we get together and collaborate on this? And I mean, that's always going to be a win-win situation. I mean, from our point of view, or from my point of view, patient safety is paramount. Right? Patient access is paramount, and everything that we see, all the research that is coming out, all the other countries that have already moved forward with something, with telehealth, with e-labeling, the proof is already there. Yeah. It's just we need to make it the African solution, because this is Africa, and tailor-make it for ourselves.
Yes. Thank you for sharing that. It's quite important, because sometimes I feel like the policymakers really they don't understand, they don't have the information, they have the data. So even themselves need to be educated, or even be sharing with them, like, what's the cost of not doing anything? What's the cost of not having a universal healthcare in your country? Because then the financial cost is really much higher than if they had started putting policies in place and providing those incentive to population. So definitely a lot of work to do there, for sure. You both talked about data earlier, and data privacy is a growing concern globally. So how do your organization handle the data security, and what measures are in place to protect the user information in countries with evolving data protection laws? Maybe Nasser?
No problem. Happy to start. I think Nishan talked about access and safety, and you cannot disconnect that with data, right? Because what we are doing, we are using data to show the government a rational approach of offering healthcare in a scarce environment. So one example, you can see 2-3 partners working in the same location, combating the same problems, whereas there are other things that these partners can be working on if we had evidence and data that what they are doing is repetitive. So right, so data help government coordinate better on the problems and the challenges that are going on in the community. I just wanted to share that from the perspective of safety and access. Now, in terms of confidentiality, what we are doing is the communities we are serving, in all honesty, they do not understand what confidentiality and safety mean for now. But that does not mean we should not educate them on that. So what we tell them, it's the data belongs to you. This is how you can use it, and you should give permissions to someone to access your data. We are trying to do it. It's funny for them, but we do it. From the government perspective, they told us what we can do and what we cannot do, and they make it extremely hard, at least in Guinea. You can see a regulator who is telling you that they want you to store the data in the country, whereas they don't have a database. So how am I going to invent a database to store your data? So what we are doing, we are using end-to-end encrypted data platforms, okay, such as Amazon Web Services, and we explain to the government what it means to store their data there. There is one in South Africa, that's the one we are using currently, and what is the cost of the alternative. The moment they understand the cost of the alternative, they ask us to use the cloud solution for now. And finally, it's just alleviating the bias that comes with data. The Western world is stealing our data. Probably there has been some time where the Western world was stealing our data. I'm not denying that. But today, this is a survival approach for us to use cost-effective way to offer quality care in the absence of local databases where the government cannot build them today. So doing that work is extremely difficult, and convincing the government that the cloud solution is the best in the absence of local infrastructure has been extremely challenging on our end.
Thank you for sharing. What are your thoughts, Nishan?
I think data privacy is a buzzword, and it's a global thing. When we looked at this specific project, it was developed with that in mind. The fortunate thing about the way it was done is that it's e-labeling, so it's not taking or it's not getting patient information or the like. It's a user accessing it. Right? The other thing is that it's owned by our regulator, so they ensure that everything in there conforms to all our data privacy policies and the like. So yeah, I'm not the tech guy in terms of that, but it's something that everybody needs to look at.
Yeah, absolutely. And that education piece of the policymaker is so important. The more I listen to you both, it's always go back to, putting the regulation in place, having the right infrastructure in place, but it starts with educating those policymakers so they can see the value of what we are trying to do. So that's definitely a lot of more work to be done, but I think with people like you guys, it's going to be fantastic. This has been like quite an interesting conversation, but I want to make sure I have like so many other questions, but I'm going to make sure that, we have time for questions with our audience. So why don't we get started with any question that we have in the audience right now?
If anybody else can feel free to raise their hand, but I'm going to read some of the questions that are on the audience here for us. The first one are, who pays for the information development, processing, and distribution? And what measures show impact and satisfaction with the information provided?
I can briefly talk about it. So we are building our own infrastructure. That's the private sector. Everywhere in the world, what we notice is government is not good at building this type of infrastructure. So we are building them on a pilot mode to show the government what it looks like, and then partner with the government to scale them through bilateral funding, and hopefully transition that toward having the government adopt it and pay for it. That's the plan.
This one is specifically for Nasser. Has there been any learning and actionable policy challenges that we have created due to the Guinean Ministry of Health starting to collect data digitally?
So that's an interesting question. So what the Guinean Ministry of Health understood when we started doing this work is they were not themselves ready to regulate us. They needed more learning, more experiences. So one policy that we were able to help the government change is that policy of not allowing anyone at the community level, any medical provider at the community level to offer secondary level of care. So in Guinea, there is primary level of care, and then malaria, diarrhea, pneumonia, and so on. But secondary level of care requires for you to have at least a physician who is in a hospital setting, right? And then the third level of care will be national or general hospitals, right? So what we told the Guinean Ministry of Health is, it makes no sense to take a piece of paper and give it to someone and ask them to travel to pay $12 and go see someone to have a conversation. You're not opening their head, you're not opening their hearts. So why can't you flip that policy? Because the community health workers at the community health center level, if they had done it, they would have lost their job, right? So the Guinean Ministry of Health flexed that to allow us, instead of having an in-person referral, to have a virtual referral through telehealth, and give these community health workers an opportunity to connect the patients to care at the community level.
Thank you, Nasser. This one is more generally for the panel. This attendee is curious to learn how they can learn from the continent and how we can create best practices in exchanging ideas on this topic.
Yeah, I mean, it's entire collaboration, right? I know lots of the work that we're doing currently now in South Africa, colleagues in other countries are looking to us and say, well, how do we start this? What did we do to get this process running? So we can learn from the continent itself. with e-labeling, there are countries outside of the continent that have done it to varying degrees, right? I don't think there's very few countries that have totally adopted it, but use them as a sounding board, which we've done quite often, to be able to put these types of initiatives forward, right? Because we don't want to reinvent the wheel. We want to learn what's out there and adapt it to our unique situation.
Absolutely. Learning from each other. And Nasser, is there anything else you would like to add to that question?
No, thank you. Well done.
Okay, wonderful. I think there was one more question here, like any example from African countries of patients owning their own electronic health record as a self-care mechanism.
I can start on this one. So digital health is very new in Guinea and in some West African countries. It's very new. So the patient own it, but do they know that is there an infrastructure, a mature infrastructure that enable them to know that they own it? Is there a mechanism through which they can claim it, right? So it's like you have a right, but you have not exercised that right yet, because there are so many pieces that are missing within the puzzle. And that's the first thing. The second thing, when these people come to care, they come in a crisis mode. So their thought is not who owns what. It's how am I going to prevent that death that is going to happen, or that crisis that is going to happen. And the government, at least in Guinea, is very reactive. I'm going to get in trouble if they hear these things. They are very reactive. They do not plan this. They leave it up to partners, bilateral organization, international donors, right? We need to start thinking about healthcare and digital care and digital medical record the same way we are thinking about education, the same way we are thinking about our livelihood, because that's the future of our continent. Self-care is the future of our continent. In the next 5 years, it will be likely that everyone has a blood glucose meter and a blood pressure monitor home with their smartphone, whereby they can input the blood glucose and blood pressure and forward that to a medical provider, rather than hoping on a car to go to a hospital. Why? The likelihood of having the digital devices is higher than building the roads. It's harder. We do not have any. We can buy the devices, but we cannot force the government to build the road, and we don't have the money to build the road. Even if we have, we don't have the cars to go there. Even if we have, we don't have the medical providers who will be offering us the services. And people are buying an experience. If you go to the hospital one time and you are not satisfied, the likelihood for you to go back again will be very low, because you are burning existing infrastructure to go get something that you are unable to get.
Yeah, it was very powerful words. Nasser, very courageous of you, but I would agree. As we approach the end of our session, Nisha, is there any, share any one key takeaway or prediction for the future of digital health and e-labeling in the continent, in terms of improving health literacy and also self-care?
Yeah, no, I'm a big supporter of this, right? Because we help run that project. I think there's lots of things in the African context that we don't know, right? And that's what we're trying to find out. I'm hoping we'll commission studies to be able to do this. I think there was a question about how do we show success or satisfaction with what we're doing, and that's the data we need right now, because that's going to support this entire move to digital health. And that could be e-labeling, that could be telehealth, it could be whatever, AI, I don't know, whatever the future holds in for us. I think it's an interesting time. I think we're learning right now, and yeah, watch this space.
Yeah. Thank you so much for sharing. We're almost at time, so I really wanted to thank you all for your time, for your participation, and for this enlightening discussion. And we hope that you'll take this insight and continue to explore the potential of digital health and e-labeling in your own, context. So in the meantime, I will just, my ask is stay curious, stay innovative, and most importantly, stay healthy. So at this point, I'm going to pass it on to Fatuma. Thank you so much.
Thank you so much, Ndeye. And thank you for those closing remarks. I just want to extend a deep appreciation to our panelists today, Nasser, Nishan for joining us, and for Ndeye as well for sharing your insights and experience, as well as moderating this very helpful conversation. And of course to Dr. Josephine Fubara for her earlier context setting. So wish you all a great rest of your afternoon and evening, and continue the conversations. And as Ndeye mentioned, these conversations and discussions and forums that we have are really so crucial in pushing the needle and inching it forward and forward. So appreciate everyone's insights, and wish you all a great rest of your day.
Wonderful. Thanks, everybody.
Thank
Thank
you.
you.